I can see that. Oh,
Well, have a good one. See you.
Good evening. Thank you for being here this evening at tonight's Board of Education regular meeting. So just normally, I'd like to also invite the public to know that they can watch meetings, school board meetings on Oshkosh Media off the city's website. You can also watch them live on YouTube. They can be viewed on Spectrum Cable Channel 10 and UVerse Channel 99 in the city of Oshkosh, or free on Oshkosh Media channels on your Roku, Amazon Fire, or Apple TV. We encourage the public to be engaged and to view our meetings through our multiple avenues to view the meetings. So, as you all know, the school district has implemented an optional mask policy, and there are many of us in the room that are masking at our own free will, because we feel it's the best example to set, not only for ourselves and our community, but even in my case, potentially for my family as well. So we encourage anyone that feels the need to mask up to be able to do it. So, all right, so let's start the meeting. Is our meeting in compliance with open meeting law notification?
Yes, it is.
Thank you. Please call the roll.
Carnes?
Here.
Heschel?
Here.
Salaji?
here.
Wright?
Here.
Wyman? Here. Carlin?
Here.
Herzog?
Here.
We have a quorum.
Thank you. Dr. Davis, would you lead us in the Pledge of Allegiance?
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. So next up is the board administrative reports. I do not have a prepared president's report this evening. Mainly, a lot of my extra duties have now been taken up in the presence of Dr. Davis, so I'll let him meet with his superintendent report.
All right, great, thank you. So a lot of activity in the community, so just wanted to highlight, first of all, and congratulate Beth Schendel, OASD Early Learning Principals, who was recently was asked to present at the Elevate Conference on Building the School Family and Wiring for Willingness. The invitation came from Becky Bailey, a renowned educator and internationally recognized expert in childhood education and developmental psychology. So it was a great honor for Beth, so congratulations to her. Next, we had, in an effort to learn more about how to regulate their own emotions in order to help children do the same, we had a group of administrators and teachers recently attend a conscious discipline conference. So that conference is work that we'll apply to in our professional development as we're moving forward. So thanks for everybody who committed time to that as we went. Congratulations to Carl Traeger Elementary, Merrill Elementary, and Webster Stanley Elementary schools for being recognized for their implementation or progress in equitable multi-level systems of support framework. Congratulations and great work on those from those teams. Next, also congratulations to the OASD team of Steve Abler, Brian Fink, Steve Freeman, Tom Pickard, and Nate Spanbauer, who attended the Custodial and Maintenance Conference and won the team prize in the Safety Room Challenge, where they correctly answered as many questions as possible in a 2.5 minute period of time. Kind of like a Jeopardy question, I think. So congratulations to those guys, nice job, keep up the good work, and thanks for keeping our district safe. So that is concludes kind of our announcements, and then just a quick look at superintendent's calendar. Certainly have been active both inside the district and outside. Had an opportunity to witness probably my favorite event up to this point, which was the Adaptive Sports League wiffle ball game, and just a great opportunity to see our kids and students in action. So I appreciate all the invites, and we'll continue to stay active in the community and as we start up schools in classrooms. So. That concludes my report for tonight, so thank you.
Thank you, Dr. Davis. Next up is we have District Administrator Supplemental Reports. We have a COVID-19 update from Matt Kamer.
Good evening, everybody.
Good evening.
So I'm going to be resuming my COVID-19 reports for each board meeting as I did prior to July. So how I typically kick off these reports is I talk about the weekly COVID-19 data summary from the Winnebago County Health Department. So they come out with this summary every week. It looks at the past 2-week period. And what they do is they look into the case rate for the overall county and then each school district, and they divide the school districts by their geographical boundaries. And then they look at total cases, positive cases of COVID-19 in that area. So for the weeks of July 21st through August 3rd, our district case rate was 116.9, which placed us in the high category. And this was an incremental increase from, well, really since the middle of summer, we've seen a gradual increase in that case rate. In terms of students who are 18, or children who are 18 years old or younger, the district had 12 positive cases in that time period. So that gave us a case rate of 81.7 for school-age children. And we got the preliminary data for the next 2-week period today, and the numbers have gone up again for that age group, and we're looking at 19 cases for the past 2-week period ending today. In terms of the district procedures and mitigation strategies, I'm going to skim over that just because that's going to be covered in more detail in our COVID-19 handbook report. I did want to mention, though, that the district continues to urge people who are eligible for the COVID-19 vaccine to become vaccinated. Just for reference and about some upcoming vaccination opportunities. Walk-in Wednesdays continues to be in place at Sunnyview Expo Center every Wednesday from 1 o'clock to 6 o'clock. There's no appointment necessary for that. Also at the Farmers Market this Saturday, there will be a vaccination booth set up for anybody who's interested. And tomorrow at Perry Tippler Middle School, from 3 o'clock until 6 o'clock, there's a vaccination clinic, again with no appointments necessary. And the Winnebago County Health Department continues to update their vaccination page on their website if you want more information on that. Some exciting news from a district standpoint is we are currently working with NOAA Clinical Laboratories to set up diagnostic COVID-19 testing at all of our school sites to start the school year. So I am meeting with NOAA Clinical Laboratory this week to continue to hash out some of the details with that, but we will have testing available. We need parent consent for any test that we do with any students, just so everyone is aware of that piece, but we will have the option of doing PCR diagnostic testing or rapid antigen tests where we could do groups of students. UWO continues to have their testing site open. They did scale back their hours, so if you're interested, the link is in the board report. I would go to the website and check that out. And also Sunnyview Expo continues to offer testing as well. And one final note, as soon as the school year resumes, we will reactivate our district dashboard that keeps track of active and cumulative totals of cases and quarantines within our district. And new this year, we're also going to be tracking any suspected cases that were transmitted in our school settings. So that concludes the report.
Question. The sites that you mentioned, do any of them do under 18? We've got the Farmers Market, Perry Tippler, and Walk-in Wednesdays. Are any of those available to
Yes,
12?
I believe they all carry the Pfizer vaccine, which would make anybody under between 12 and up would be
12 and
eligible.
up, okay.
Yes.
So nothing under 12 right now?
Correct.
Okay, thank you. Just wanted to clarify that. Thank you.
I have one question.
Sure.
Earlier this summer, there was conversation, I think at the national level, about potentially offering the vaccine to 12 and under individuals. Is there, can you provide any type of update related to that conversation?
I honestly haven't heard any updates recently on that. Dr. Davis, have you?
Yeah, I have not heard any updates on that. In my conversations with area superintendents, I think the last that we heard, there was optimism around late fall. But again, that was pretty dated information,
Sure.
so I haven't gotten any information on
Okay.
that.
All right, thank you.
Thank you.
Thank you.
Thanks,
Thank you,
Matt.
Mr. Kemmer.
Thank you.
All right, next up is other reports. So this is our first meeting of the month. Typically, committee reports are done at our second meeting, unless there's a situation where someone might not be here. Is there anyone that would like to do a committee report at this point? Okay. Any other updates related to board member involvement that board members might be involved in? Go ahead.
Thank you, Mr. Peschel. I just wanted to share several things. First of all, I represented the board last night at the CISA 6 Board of Control meeting. Each district, each of the 39 districts that is included in CISA 6 will be receiving some funding. It's in the form of a credit based on how much money they had spent with CISA. And they can use that on new products and services. It can't be used to supplant, but it can be used with new services. I'll pass this around just for your information. They were very excited about that, and I think they should be. I attended the CISA 6, the WASB, Wisconsin Association of School Boards Summer Institute in July, and in your board packet tonight, you have 3 handouts from that. 2 of them deal with governance, which is a big part of what we do. And the third one deals with superintendent evaluation. It's very similar to what is in our policy with some tweaks and updates. And that's also something that the Policy and Governance Committee is looking at in terms of updating our approach. There is a webinar tomorrow night for anyone who is a school board president or who aspires to that office. It's online, and it deals with how to be a good school board president. And then finally, on October 7th, you might want to mark your calendar, the Wisconsin Association of School Boards will be holding its annual fall regional meeting. That will be in the Neenah area. There will be a program and a dinner and recognition for people who have earned points in the recognition program, which is essentially a professional development program for school board members. So I appreciate being able to represent all of you at that event, at those events. Thank you.
Thank you, Dr. Arzon. All right, next up, we have non-agenda related public forum. Can someone please provide me the sign-up list? While that's happening, I'll go through the guidelines that we have laid out for speaking in our public comment timeframes. So guidelines for public comment. Please clearly state your name and address. If you're acting as a spokesperson for a particular group of individuals, please indicate the group that you represent. Please limit your comments to the time allotted, which is 3 minutes. That'll be on the board. Please use public comments rather than a question-answer dialogue. State clearly and concisely the matters of concern. Please remember that the use of specific names of district personnel may lead to legal liability. In such instances, please pursue the district's formal complaint process by contacting the superintendent's office at 424-0160 to direct your comments to the proper administrator. All right. First, we have a non-agenda related public forum. And first person that we have on here is, I think it's Aries McDougall. Did I pronounce your name correct, young man?
Yes.
All right. I'm glad that I did that.
Hello, my name is Aries McDougall. I just finished the 5th grade at Traeger Elementary School. Today I want to talk about masks. Masks are helpful to protect you and the people around you from COVID. Masks are pretty easy to wear and I feel safer wearing a mask. Homeschooling was hard and I don't want to do it again. Everyone should wear a mask. Sorry. Wearing a mask shows that you care about the people around you. When I have a friend come over, we both wear masks and still have a lot of fun. In conclusion, that's why we should follow the rules and wear masks all the time at school. Thanks.
Thank you for coming.
Thank you.
Thank you for your comments, Mr. McDougal.
That's awesome.
All right. Next up is Effie Sidmos. Did I say your name correctly?
Yep, that's
All right,
great.
wonderful.
I'll put my timer on. Hi, my name is Effie Siomos. I'm a physician. I live here in Oshkosh at 2060 Morningstar Lane, and I have kids at Oshkosh West High School and also at Traeger. I'm concerned about the optional masking policy at the Oshkosh School District. This is in direct contradiction to the CDC, the American Academy of Pediatrics, and the state superintendent's strong statements to universally mask all kids and adults while indoors at school. And I would urge the school board to adopt universal masking. But I don't want to stand up here and talk about rules and regulations or how we should protect older adults. What I want to talk about particularly is how to protect our kids, because this Delta variant seems to be acting very differently than COVID in the past. So even though cases were declining in the early summer, which we heard about before, we're no longer in that position of beating COVID due to the Delta variant being significantly more contagious. This is a different disease. By CDC definition, there are already high levels of COVID transmission in the area, and those numbers are going up. But I'm worried more about how this is affecting our kids, and we're just beginning to learn this. So kids previously accounted for only a small amount of COVID cases, but in the last 2 weeks of July, kids account for 35% more of the positive COVID testing than previously in COVID. So more kids are now getting COVID. And what's concerning as well is that COVID hospitalizations for kids seem to be going up as well. So it might be, and we don't know for sure, that COVID or Delta variant of COVID is making more kids sick and making them sicker. You hear stories in the medical literature about New Orleans, Orlando, where hospitalizations have increased significantly from kids, whereas a couple months ago there were no kids with COVID in the hospital, and now the inpatient units have up to 20 kids in beds and full COVID units. It's unknown really at this time whether the Delta variant is just particularly targeting kids specifically a little bit more than previously for COVID, or if just more kids are getting sick and more kids are being hospitalized. But there is some clear association between the Delta variant's hypertransmissibility and increased pediatric infection and increased hospitalization. We depend on schools to keep our kids safe, and studies show that transmission of COVID is low when proper precautions are in place. So that's the good news, right? Transmission is low in school, and that includes universal masking. But I agree, masks can be a nuisance, right? Classroom quarantine, learning from home, missed work, missed activities, sick kids, and hospitalizations are so much worse. Our kiddos are definitely worth protecting, and I challenge anyone to stand up here and say they're not worth protecting. I know there are others in the area that feel this way, so I did start an online petition and circulate it to a few folks that in support of universal masking at the school district. And in 48 hours, I elicited over 115 responses from area interested folks that felt like universal masking should be done at the school district. I didn't know that was on. Nope. I apologize. No problem. So please join me and consider our kids' safety. Thank you for your time.
Thank you. Thank you for coming.
Thank you.
All right, that completes our non-agenda related public forum. Next up is our agenda related public forum. It has the same rules that I read previously related to the non-agenda related public forums. So,
Hey, Doctor, I just got here. Is it okay if I give you 1 minute more to talk? Sorry I'm late. Is that okay? The chair?
well, I don't know where your comments lie, whether it's within the agenda or not within the agenda.
It's about the masking too. I'm for masking up.
Sorry. Yeah.
It's, I think, this one, right? Because that's non,
Well,
it's non-agenda. Go ahead and bring someone. Sir, you can come up to the table.
Yeah. You need me to sign that or something?
Yep.
Thank you, Doctor. Close it.
Yeah, good to see you.
Yeah, thanks.
Sir, can you say your name?
Danny Johnson.
That's what I thought. Thank you. Mr. Johnson, thank you for being here tonight. We need you to say your name and your address,
Yes,
and then you have 3 minutes.
okay. Very easy, I'm Danny Johnson. Some of you probably have seen me. I'm at 613A Wagoo in Oshkosh, Wisconsin.
Go ahead, sir.
I'm probably going to reiterate the comment. I think I followed the comment of the person before, the little bit I caught. Sorry I was late. My cab drove off and left me. Didn't pick me up like they should have. You know, I'm for masking. I'll say that straight out. I've been in this fight since way back when. I was an essential volunteer. I went into posting signs on some of the businesses downtown about masking. Now I'm working with vaccines. Our vaccine level is low in comparison to where I'd like it to be. We're making more contacts. I work on farmers market, in the farmers market on Saturday at a special clinic that's set up. We give out little 3x5 cards. If I can discover one, I'll bring it out. Yeah, here we go. Tell them when the next vaccine is happening in the clinic there. Last week, for instance, we made there were 100 contacts. There were 60 contacts and 100 vaccinations given out by that clinic. I'm a little concerned we're short on the Johnson & Johnson. People want to do the easy way out, grab the one shot Johnson & Johnson. Last I heard, there was only enough for 60 vaccines. That's 60 people. My understanding of the figures is we're about 10,000 short of making ideal contact to, everybody we can. I'm a little concerned for the safety of the children, like I think my predecessor here stated. It is a concern. I'm thinking, well, there's two forms of logic here. One, I'm thinking everybody should vaccine up. It's rather apparent and obvious and logical that it's either you vaccine or you pass away, as far as my logic said when I first got it anyway. That's me. I'm a veteran and I got it very early on. But I'm thinking that still may be the case, and I'm thinking for other people that should be the case, that they realize that it's a good idea to get vaccinated. I'm seeing this variant that's out there. I'm sure it's attacking people that haven't been vaccinated. I think it's going to get worse and not better. And I think our children are going to be more exposed to stuff. I would rather see, I myself have been masking up every single day since this thing started. There's a lot of masking. You get used to it after a while. I think the children are at risk. I think this variant is going to split again and be even more deadly, is my standing where I'm at right now. I would like to see them mask up. It's good for their safety. It's good as a a projection of where we stand as far as safety for children and as far as safety in the image of the whole community.
Mr. Johnson, I want to thank you for your comments. I've provided you over 3 minutes of
I thank you for that. I noticed that. I thank you very much. Thank you, ladies and gentlemen of the board here. Glad you're here.
Thank
you for coming.
I'm sure glad
Nice
that
seeing you,
we,
Chris.
Yeah,
I'm
nice
glad that
seeing
we
you.
had the opportunity to provide you to speak tonight.
Thank you very much. Dr. Bryan?
Thank you.
Thank you.
All right, so back to agenda-related public forum. First on the list is Miss Ashley Romlo.
Hi there, I'm Ashley Romlo, 3011 Hayward Avenue. I'm also here to talk about masking. Apparently I just signed the wrong sheet. Apologize for that. I'm the parent of a second grader, so a child too young to be vaccinated against COVID-19. My child, the 7-year-old, is really good at remembering to put her mask on, but like any other 7-year-old, gets busy, gets excited, and sometimes forgets. And she's 7. So she doesn't understand all the potential consequences of forgetting that mask. She doesn't understand the weight of that forgetfulness and the way that this Delta variant could tear through our family, could impact her 2-year-old brother, could impact her fellow classmates, her teachers, the rest of this community. And really, she shouldn't have to understand those things because she's 7. The weight of COVID-19 should not fall on a 7-year-old. The burden of this, the job to protect these kids, falls to us, all of us, the adults that need to make good and safe decisions based on the evidence. These decisions need to be made at the administrative level and applied throughout the entire district. It should not fall to individual children to remember their safety rules. And it definitely should not fall to the individual teachers to have to try to learn each family's needs, try to enforce them, keep themselves safe, keep their classroom clean, and try to educate these kids. So what I ask is that you follow the evidence and the guidance from the CDC, DHS, and the local health department and enforce a mask mandate throughout the entire district. I ask that you create space to distance in the classrooms, build cohorts as able, and provide protective barriers when kids are not able to wear masks. This is what we need to do as adults. This is how we keep these kids safe. And at this point, that should be our #1 priority. Thank you.
Thank you.
Thank you for coming.
All right, next on the list is Miss Julia Salomon.
Hi, may I ask the wait time not start until I set up, please?
Sure.
Thank you. I figured we are at the Central District of Schools, so I have a show and tell.
I love it.
Hi, my name is Julia Salomon. I'm 1320 Snowden Drive, and I want to introduce you to my daughter. She is a junior at West High School. She is vaccinated. Many of her classmates are not. She's right here. These are the viruses. We have Alpha, wild-type COVID. We have Delta, much more transmissible. Actually, 2 to 3 times more transmissible, and we still don't know the long-term effects of COVID. They're right here. One of the things that worked so great last year, and I realize the situation right now is different than last year, we didn't have Delta, makes it worse, was the fact that you guys had, at the school district, all of these mitigation measures to protect my child. More than half of our kids are not vaccinated. There goes that mitigation. Making masks optional, there goes that mitigation measure. Physical distancing, God knows our kids are not very good at physical distancing. There goes that mitigation measure. Hand hygiene, Little kids, hand hygiene, not so much. Avoiding touching your face. I don't mean to sound creepy, but I've been observing all of you, and almost every single one of you have touched your face during this meeting. You've rubbed your eyes, you've touched your mask, you've rubbed your nose. Expect that from the kids. Cough and sneeze etiquette. You know that mitigation measure is going to be out the window. Staying home when ill. I can tell you stories of kids that were ill that came to school. Staff members too. Oh, I just have the allergies. Oh, I just have a cold. There goes that mitigation. What's left? Quarantine and isolation that happens after the fact. That does not protect my daughter before that. And proper contact tracing. That's after the fact. You've now left my daughter vulnerable to the Delta variant of COVID. And not just my daughter. You have 9,500 students in your district. You have maybe 2,000 staff members in your district. That's 11,000 souls that you have in your district. One of the reasons that we did not have so many cases in our schools was because of all of these mitigation processes. And not one is enough. You have to have a multi-pronged approach to protect my daughter, who is fully vaccinated. Just because she's fully vaccinated doesn't mean she can't get COVID. It just means she won't die and she won't end up in the hospital. Thank you.
Thank you for coming.
All right, next up we have workshops. First one is a COVID-19 handbook for 2021-2022, to be led by Mr. Cameron.
Hello again. All right, to begin the presentation, I just want to touch on a few points of emphasis that are going to be consistent themes not only as we review the handbook, but in the weeks ahead as we talk more about COVID-19. First and foremost, the district is committed to in-person learning this year for the 2021-2022 school year. One thing you'll notice is we don't have different instructional models in place that include hybrid and at-home learning like last year. We do still have e-academy in place for any families who are interested, but we are committed to having in-person learning throughout the school year. Another point of emphasis is that this handbook, the adjustments that we've made to it are not set in stone. We will continue to monitor, update, and guidance and make adjustments accordingly. And some of the pieces of information and the guidance we receive include information from the Winnebago Health Department, both guidance and data, information from organizations such as the CDC, Wisconsin DHS, American Academy of Pediatrics, and other reputable scientific organizations. We also take feedback from community members and other stakeholders. And then we also really focus in on our local data trends, especially for those who are 18 and under. Another key point of emphasis is that as we continue to see our case rate increase, or if we continue to see our case rate increase, we do have a number of mitigation strategies that we could layer on, and I think Ms. Solomon did a nice job of referencing a lot of those mitigation strategies that we're prepared to put in place when we deem necessary. And this is especially true at the elementary level where we know students aren't eligible for the vaccination at this point. And of course, we want to continue to encourage those who are not vaccinated and eligible to be vaccinated to go ahead and do so. So this chart is just a point of reference for the case rate related to those individuals who are 18 years old or younger in the Oshkosh Area School District. And I referenced this number during my COVID presentation, but one thing this slide does is it shows the trend, not only by the number of cases, but the case rate over the course of the past couple of months. So if you look at going back to May 5th, For our school district area, we saw a gradual decrease up until mid-June, and since then, we've seen a gradual increase. And again, data for this last 2-week period will show an increase again, as we had 19 cases for the past 2-week period. And this chart here, again, just shows it in line graph format. But again, this looks at a number of different age groups, so 5 and under, 5 through 9, 10 through 14, and 15 through 17, and just shows the trends with positive cases in our area through that period of time. Just for a little background on the handbook itself, this handbook was created prior to the start of last school year by a group of administrators. School nurses were also involved, as well as other stakeholders. For this most recent update, it was updated by members of the administration team, including principals. We also consulted with our Director of Food Services, Director of Facilities, the bus company, and others. And we did receive feedback on the handbook from the health department. The decisions that were made related to the handbook were based on the local data that we were seeing at the time of its creation, and then taking in consideration guidance from the health department and other organizations as we applied it to that data. Any changes that have been made to the handbook since its original creation are going to be in red font. There are a few changes that came up throughout the course of the week that are in red, but any that we make from here on out will be in red font so people can compare and contrast from where we started. And one other key point is that we've learned a lot about this pandemic over the course of the past year, and I know Delta is quite a bit different than what we've been dealing with all along, as you've heard earlier. But in terms of mitigation and some of the things related to surface level transmission, we've been able to kind of change around the way we do things from the beginning of this past school year. So in terms of our handbook, we have 8 different sections. So I'll just touch on the key or the highlights of each section as we go through. So in terms of operation and healthy environments, one thing we really want to emphasize is our building ventilation. So we will continue to use high-grade filters that are capable of filtering out COVID-19. We had those in place last year. We will continue to have those in place through the upcoming school year. And along with that, we're going to make sure that our air exchanges are functioning at full capacity throughout the school day. When we have warmer days here at the tail end of summer, our maintenance staff actually comes in early to get those air exchanges started right away so we can pump more cool air into the schools in the morning hours so they don't get quite as hot throughout the course of the day. In terms of cleaning and disinfecting, our custodial staff will continue to focus on high traffic or common areas, while our teachers will be asked to disinfect desks, tables, toys, and manipulatives, and other shared supplies at the end of each day. And then one thing that we're going to make sure we emphasize at all grade levels throughout the course of this year is hand hygiene. In terms of physical spaces, we aren't going to have universal barriers. As we did last year, they will still be available in situations where staff members may be working with students one-on-one and they request them. But as I mentioned, they won't be provided universally. Drinking fountains, lockers, and hooks will be back in use. However, we are encouraging students to still bring water bottles to school for their personal use. And we will continue to have sanitization stations in place throughout every one of our schools. We will also continue to use isolation areas in all of our schools for individuals that meet our COVID symptom protocol. Those are areas that students can go where we can isolate them with a mask on and wait for their ride to arrive, and we can escort them out of the building at that point. In terms of food service and cafeteria protocols, we will continue to use general food safety measures going into this year, which include plastic and disposable utensils, restrictions on sharing food, and having plastic barriers between students, the food that is being served, and our food service employees. Schools will be returning to normal lunch schedules, but we will continue to encourage as much spacing as possible in those settings. Elementary students will be assigned to tables during the lunch period to help with contact tracing. And then if there were a school that had to close for a period of time, we would continue to provide grab-and-go meals for the days that they were not in session for all students.
Excuse me, would we be providing grab-and-go meals if it was, let's say, an elementary school and it was a second grade classroom? Would we also provide on a classroom basis, or would it have to be the entire school that would be closed?
That's a good question. I honestly don't know the answer to that,
Okay.
so I'll have to check with our food service department.
Thank you.
This fourth section is operations or day-to-day procedures. So the district will be limiting our visitors and guests in each of our schools. We will allow them for instructional purposes or supervisory purposes, but that is the extent that they will be allowed. Parents will continue to remain outside during pickup and drop-off times. We want to try to limit shared materials as much as possible, so students will continue to be encouraged to have their own personal materials. And if there are things that are shared between students, we want to make sure that they're sanitized on a regular basis. In terms of IEP meetings or other meetings, we're going to continue to give parents the option of attending virtually. We had really good attendance last year with a lot of our families, and they really just prefer that method, so we want to continue to make that available, while in-person meetings will be available as well. In terms of face coverings, they are going to be optional at this point, but there are a few exceptions to that. So one exception is if students meet the COVID-19 symptom protocol while at school, they will be required to put a mask on until they exit the building. Along with that, students or staff who return on an abbreviated quarantine timeline after being designated a close contact would have to wear a mask for the duration of the 14 days they would typically have to quarantine. And I'll get into that a little bit more here later on in the handbook. And then students who are in music classes where singing is going to be taking place, sustained singing, masks will be required as well. I think the research shows that projecting your voice over a period of time can lead to higher rates of transmission, which is why we put that in place as well. Field trips, large gatherings, and safety drills will be permitted as they have been in the past. And as I mentioned, hand hygiene is going to be a strong emphasis, and we're going to require students to wash or sanitize hands both before and after recess. And that will limit how often we actually have to sanitize the recess equipment outdoors, which can be difficult to clean and sanitize at times.
As far as the word supervisory,
Yes.
is that going to, are volunteers going to fall under that category or no?
Yeah, some of our schools really rely on volunteers to supervise, whether it be recess or lunch. So that's what we mean by supervisory.
Okay, thank you.
Sure. In terms of transportation, masks will be required on our school buses, and that is a federal requirement that's in place for all public transportation, school buses included in that. However, normal capacity limits will be used on all buses. Students will be assigned seats on buses to help with contact tracing, and then our drivers and bus company staff will continue to clean and disinfect our buses after each route. In terms of instructional models, as I mentioned right off the bat, we are committed to in-person learning, with e-Academy being available for those that want a virtual option. One thing that is going to be a little bit different this year is when we do have students who are home, whether it be due to having symptoms of COVID or if they're on a family vacation, the makeup practices for those students is going to be the same in all instances. So we're no longer going to be live streaming classes throughout the day. We will just have traditional makeup practices in place for those individuals. But we are going to continue to leverage Canvas as a district, which I know is a great resource for our teachers and our families in helping their students keep up with the work and instruction going on in the classroom. And one big emphasis this year is also going to be our focus on social emotional learning and mental health. One thing we do know is that COVID and the isolation and different things around that have had an impact on the mental health of many. And we want to be sensitive to that, and we will make sure that our students who have social, emotional, or mental health needs are taken care of.
Excuse me,
Sure.
Is there a deadline for signing up for e-Academy?
As long as we have seats available, you can sign up. So before the start of the school year.
Thank you.
Julie?
couple questions in regards to staff flexibility to be able to do some of the things that we're saying that we don't necessarily want them to do. Not that we don't want them to do it, it's just something that, it's not suggesting that we want them to do it. Last spring I did several, you got me touching my mask all the time. So, I did some tours of a couple of the high schools and middle schools last spring, and some of the elements that I thought were very innovative was the ability for some of those teachers to be able to do a live streaming aspect of education when, say, a child is quarantining or is unable to be there. To me, this takes away a little bit of flexibility or the option of doing that, where there might be teachers who are tech savvy enough to be able to do that and manage that and provide that. So I guess my question is, are we in a position where we might be able to try the flexibility of to allow staff to be innovative to provide instruction when it's challenged in situations like that?
Yeah, I mean, from my perspective, I think we could entertain that from a staff, if we had a staff member that, came to us and said they were prepared to do that. We also know for many of our staff that that's a big undertaking in addition to, managing things in front of them. So I think I'd want to take that on a case-by-case basis.
I guess I just didn't want to just put it out. I just didn't want it to be like kicked out as an option when, we've talked about for years now of being able to be flexible for every child's needs. So.
In terms of flexible and responsive staffing, we are likely to continue to have sub shortages this year. So as a district, we do have a triage plan to fill our sub absences. We used it last year. It's something we'll continue to use this year as well. And then the last section of the handbook is our response to COVID-19 symptoms or exposure. So some of the, in terms of when we would exclude a student or staff member from school, there are a number of scenarios under which we would do that. So the first is if someone has a fever and takes fever-reducing medication within the past 24 hours. Another scenario would be if they have a positive COVID-19 test and they have not yet completed their isolation period. So that would be either with or without symptoms. Similarly, if an individual was diagnosed with COVID-19 by a healthcare provider and they haven't completed their isolation period. And again, just for reference, if somebody does test positive for COVID-19, they would have to isolate for 10 days from either when their symptoms first began or when the test sample was collected, if they are asymptomatic. If an individual has a pending COVID-19 test by someone in their household, they would also have to stay home in quarantine. That doesn't include run-of-the-mill tests that are done, like if a parent or somebody was going in for a surgery, in those situations, we wouldn't require the student to be excluded from school, but this would be more, so when the house has symptoms, they go to get tested, we're going to want them to stay home until those test results come back. And then finally, in terms of our COVID symptom protocol, it's the same as last year. So anybody within the past 24 hours who experiences a cough, difficulty breathing or shortness of breath, or new loss of taste or smell, we would want to quarantine and go to get tested, or if they have 2 or more of the following symptoms: a fever of 104 degrees or higher, diarrhea, muscle or body aches, sore throat, vomiting or nausea, headache, fatigue, or congestion. Again, we would want them to stay home, get tested.
Can I ask a question?
Sure.
This was brought up earlier, and my son fell into this last year. Allergies. Allergies, could be a couple of those symptoms. Are we going to require positive test on that, and then if they come back, but then they're okay once they're cleared, because that's what he went through? I'm thinking they can flare up every week, every couple days, every couple weeks. Like, do we have any contingency for that? I know that's kind of...
Yeah, that becomes a really difficult situation, and in most cases what we recommend is if you do have symptoms, even if they're allergies, you go and get tested just to be sure. And what we always want to consider then is what is that individual's baseline. Okay. So in your situation, if your child has allergies, we wouldn't make you go in and get tested every week.
Okay.
If
The symptoms stay the
We
same.
know what the baseline is, we have a negative test for that.
Okay.
You know, we would work with you throughout that process, if that makes sense.
So just to add on to that, because I've had similar situations where I have a child who has certain conditions that mirror COVID symptoms. And one of the things that we did as parents is we made sure to go get them checked, you know, obviously for COVID as well. But also when we were meeting with the doctor, we asked the doctor to indicate you know, the medical condition and what types of symptoms that medical condition might have. So that, one, it creates that much more education within the nurses department. They know what they're dealing with a little bit more and such as well. So it's just another line of communication in regards to helping our staff kind of weed through all of that stuff as well.
Yeah, that's a great point. So if there is a differential diagnosis, it's important to let our nurses know so they can factor that in. But one thing I am really excited about is the opportunity to have testing on site. So that's really going to expedite the process if we do have someone who's symptomatic. We don't have to send a parent across town to get a test. We can do it right at school if they consent, and that will speed up the amount of time that our children are actually out of the building. Also in section 8, it goes over some of the pieces related to close contact quarantine. So asymptomatic individuals who are close contacts will not have to quarantine at this point. And again, that does not include household close contacts. With that being said, parents will still be notified if their child is a close contact, and we would ask that they watch their child very closely for symptoms, and if their child starts to experience any symptoms, they keep them home. Household contacts, so if the student has a parent or sibling in the household who has symptoms or is a positive case, that individual would have to quarantine for up to 14 days. Now, there are options for short quarantine timelines if that individual remains asymptomatic. So if they're asymptomatic after 10 days, they could return, but would need to wear a mask through what would otherwise have been the 14th day of that quarantine period. There's also an option for a 7-day quarantine, but with that, again, the individual would have to be symptomatic and have a negative test result from a sample that was taken on day 6 or later. And again, upon their return, they would have to wear a mask through what would otherwise be that 14th day. We are going to continue to use our line list to track any positive cases or quarantines throughout the district. And then our district dashboard, like I mentioned, is also going to be reactivated as soon as the school year begins. That's our overview.
Any questions?
I have 3 questions. Where can they get rapid testing in the community if like a parent or teacher wants to be tested and thinks they might have symptoms? Do you happen to know?
Yeah, so my hope is that we have rapid testing available at our buildings to begin the year.
Okay.
But UW Oshkosh continues to have
Great.
Their testing site available. Again, I think they scaled back the hours, so you'll want to check into that. I know Amro Pharmacy also has rapid PCR testing that they do.
Okay.
I know we have some health department representatives back here.
They're not here representing.
Never mind, they're not here. Okay.
Okay. My second question was,
sure.
sorry to interrupt, was related to the abbreviated quarantine. That's the 7 days that you were talking about?
Yes.
Okay. Okay. And then I had a question about timing. Why did you guys want to come out and get ahead of this and go optional? Maybe perhaps this is a question for Dr. Davis to speak a little bit about, why we wanted to come out and say optional at this point.
Yeah, so again, we've been following the recommendations, working with the local health department, following recommendations from the CDC, but also in the context of all of those recommendations, looking at our specific data points that we had, and Mr. Kammerer had provided some of those points. So we're monitoring those closely. As we monitored those at the beginning of July and towards the end of July, they started to tick up. But at the point of our preparation, as we are putting together our protocols, having it reviewed by our principals, having it reviewed by our nurses, we felt that mask optional at that point was the way to be able to go. So what we continue to do is review our data points. If we continue to have a trend that is going in the way that it's going right now, then we'll likely be entering that high area, that high category, if you will, over the next couple of weeks. So that would be a situation where Mr. Cameron and I will talk with our local health department, and then look, based on our data, be able to make some revisions potentially to some of these protocols as we're moving forward. But to your point about with the mask optional, for the data that was available for us at that point in time, we felt like that was the most reasonable way to go. But again, this is a fluid situation. I will say though that we, over the next week or so, 2 weeks max, we're going to have to make a decision for the beginning of the school year and those mitigation measures. What we'll need to make sure that we do when we do make that decision is that we don't go back and forth kind of week to week, with some of the numbers, because the numbers might be a little bumpy as we go. So what my recommendation would be, Mr. Cameron and I would talk about this, and what our decision would be to look at wherever we start the school year, to be able to have those protocols in place, at least those protocols in place and mitigation measures for the first quarter. So we can provide some stability for principals and for teachers, for parents and for students. What we don't want to do is go week to week, like, are we masking this week, are we not? We want to be able to have that stability. So that's something that we'll look at in our decision-making process. We are reviewing the data though. Again, we are concerned with the uptick of cases that we see, and are taking all those recommendations into consideration as we review this. We, besides our athletics, we don't have any students that are in school at this point, but we'll certainly be making that decision if we need to make any adjustments over the next week and a half. And then we communicate that out to staff and parents as we go.
Awesome. My last question, I promise, is are we offering incentives to vaccinate? Somebody asked me this yesterday, and I was like, I'm not sure if we are. Let me look into that.
No, we're encouraging those who are eligible to be vaccinated, but as
Okay.
a school district, we're not providing any incentives.
Okay.
I mean, the incentive is that if we do go to a quarantine place, you don't have to quarantine if you've been vaccinated, right? So
Right, that's true.
there would
That
be
is
that.
incentive, yeah.
And just so we have, if you guys don't mind, just so we have the data correct, right now 18 cases this last week out of 9,500 students.
For the past 2-week period, there were 19 cases of individuals who are 18 or younger within the geographical boundary of our district. So that doesn't mean all 19 of those individuals were OASD students.
Okay.
It just means that
So out of all
they live within
kids
the geographical boundary.
living within the Oshkosh area school district area over the last 2 weeks, 19 kids, or 18 kids had COVID?
19.
19 had COVID.
So, I mean, that could include individuals who have graduated or attend schools that aren't a part of the district.
Okay, I just wanted to make sure we had that data.
Yeah, and that's
Correct.
up from 12 the previous 2-week period, and I think 7 the week, period from that. So we're seeing an uptick, but yeah. And that'll be posted publicly as part of the Winnebago County Health's school report that they put out every Thursday.
Okay.
So that's available to the public. So that's the data that we're tracking on in close partnership with them as we're moving forward.
Okay, thank you.
Hold on 1 second. Sir, I know that you have your hand up, but we don't allow any public engagement after the public forums. So,
Okay. I have 2 questions.
go ahead.
Are you continuing to work with superintendents in our surrounding school districts?
Yes, yeah. So our, Mr. Cameron and I's review process is essentially meeting with our executive team on Monday afternoons to be able to review what our data says. On Wednesdays, so today I was involved in an area superintendent meeting, which includes not only our area superintendents, but also our healthcare executives, so Theta Care, Ascension, other places, healthcare professionals, along with the local health department, so Winnebago County, Outagamie County, City Menasha. So it's a really nice opportunity for us to get a good regional perspective, where superintendents have the opportunity to review their protocols, how it's going. We can learn from other people, and then just get the latest on the data. So that's good. And then Mr. Cameron and I will be setting up a Friday end of the week individual call with the Winnebago County Health Department just to review our data that comes out on Thursday and just make sure that we're up to speed. So on a weekly basis, we'll be tracking, really 3 times in 3 different venues to keep us up to speed. As I mentioned, when we get into the school year, we're not going to be making different decisions on a weekly basis, because that's not going to be manageable. But we want to make sure that we've got all the data that we need and tracking that's available.
I think it's really important because last year we were kind of pitted against other districts.
Sure.
So if we can have some consistency in our area, and there should be consistency based on the data that all of you are reviewing, I think that's pretty good.
Yeah, thank you.
I disagree. I agree with Beth and what she just said. And to clarify, the plan that's currently put forward is relatively similar to our neighboring school districts.
That's correct.
Right?
Yes.
Okay, thank you.
Dr. Davis, do you see a scenario where we would, a school would be like, fully masked, or are you going to take it on a school-by-school basis at all? Because I've heard some people ask, we're such a small school, we only have a couple hundred kids,
Yeah, so that would, again, for what we have proposed right now would be mass optional. As we would see cases, if there's outbreaks in particular cases or in particular schools, so we certainly would do deep cleaning there. And then I think having a conversation with principal and with that staff, around mitigation measures, some of which may be masking, and maybe some other mitigation measures that were brought up tonight also. So we'd certainly take that as a case-by-case aspect. And then zooming out to be able to take a look at all 20 schools, see if we're seeing patterns that we would need to do something systemically.
Thank you.
I just want to say thank you for the administration putting this stuff together and what you're doing. I know it's a lot of times a thankless job. It's at the end of the day, it's about the student experience, and it's about making sure that the kids are getting the education that they need. And so I think that I trust that looking at the data is what it is. Vaccines help. They're very important, and we're talking about that stuff. So seeing what you're doing, seeing what we're looking at, I think it's important. I think a lot of narratives get passed around, and at the end of the day, it's making sure that the students are taken care of and that their education is the priority of being in here and being around. And so I thank you guys for what you're doing.
Thank you.
Any other comments from the board members? Right.
Oh, I have one more, sorry. What can we do as a community to support the school district? How can we help get over this variant? What can we do?
Start with vaccination. Continuing to promote vaccination, continue to give that information out. I think that's really, really, really important as we're moving forward. And then stay tuned with what's going on, specifically with the Winnebago County Health Department. The data that they put out on a weekly basis is a fantastic resource, and I think maintaining that as our guiding light is really, really important as we're moving forward. And as I said, they're really able to disaggregate down to our students, our age students, not only provide the regional information as we go. So to me, those would be 2 things that I would recommend. I don't know, Mr. Cameron.
Awesome, thank you.
I was also going to mention, if you are not feeling well or someone in your household is not feeling well, stay home and get tested. Even if you're vaccinated. There have been breakthrough cases where people who have been vaccinated have become symptomatic, and those individuals can still spread it. So, like I said, stay home if you're sick, get tested, be sure.
I just want to compliment you on the concise report in the PowerPoint. There's a lot of detail in the handbook, actually. But it's nice to see a clean, concise version of that. And if anyone wants more detail, they can certainly find it, I'm sure, on the website. So thank you.
Yes, thank you.
So I have a couple questions. So hopefully it's not too many. I want to, Dr. Davis, you've alluded to the information that the health department puts out pretty consistently at this point. And there is, all of you should get an email every Thursday afternoon that provides you the information that Dr. Davis is asking about. So that's something that was put into place by the health department a couple weeks after the initial shutdown of our community related to COVID last spring. So, that information is at your fingertips on a weekly basis. So So I guess I just need some clarification in regards to masking while singing. And I want to make the connection that prolonged singing could be comparable to a prolonged lecture from a teacher, or could be comparable to a prolonged workout or a practice in our athletic programs. Correct? Would we agree with that or not?
I think from a lecture standpoint, I think that's one person. I think prolonged singing, is generally like the choir,
So we're,
would be kind
so
of
we're talking about the
volume.
group perspective.
Yeah,
there.
I think that's,
Okay.
that's what we're looking at.
So then I guess, my argument then lays more in regards to athletics, which no one likes to wear a mask while they're working out or while they're playing stuff. But on the logic of prolonged singing being comparable to prolonged athletics and motion and breathing, why wouldn't we be asking our athletes to mask up?
So some of those are outdoors. So I think that's, somewhat of a different animal. But we have, volleyball and swimming, for example, that would be indoors. So at this point, we haven't. We're certainly monitoring that. Cases that come up. I know practices have started in the last couple of weeks for football, for example, and I know tennis and some other sports. So it's something that we're, again, monitoring. So I think there's different parallels just because of the kind of tightness of that group. For a choir, using the choir example, differences between those and the athletics. From my perspective, I don't know if Mr. Kammerer would have any other feedback on that.
So, but at the same time, wouldn't that also relate to, towards band and orchestra as well, because they are also, my point here is that we are, in essence, we're targeting one class in regards to that, but there's several examples within our system that, that by using that target should also be masking.
Yeah, so one of the things that Mr. Kammerer is doing is working closely with staff. So it was the music teachers that came out and said, hey, let's talk about the handbook and maybe if there's modifications. So that's something that we're again continuing to work through. We may end up in orchestra classes, like you're saying, or some other places that would make sense as we move forward. But those are music teachers that come forward. So we're working with them on their request as we move forward. So did you have anything more to add?
I was just going to say that there's been quite a few well-documented cases of outbreaks occurring either with choirs or other venues where there's a lot of singing taking place. So I think that was the primary concern. I'm not saying that there haven't been any with athletics or with band. Also with athletics, so I mean, you think about the settings or the facilities those are occurring in, think about gymnasium versus, choir room or something along that line as well.
Sure. Go ahead.
Thank you. I know that Miss Gloria Dorschner, the band director at Oshkosh North, about this time last year was looking for volunteers in the community to take fabric and create, they almost look like shower caps for the various instruments, because you either blow into some metal piece or in the case of a reed instrument, I think that'd be extremely difficult to play, especially a reed instrument with a mask on. I've never tried that, but I used to play a reed instrument. I had enough trouble without a mask. But she had these like I said, like shower caps created for instruments, the brass as well as the woodwinds, and so those were at least 2 ply, so they should assist much like a mask that we would wear sitting at this table. Right. So I thought that was pretty creative because she didn't want the spread by a student who was blowing into an instrument. Mm-hmm. So that was one mitigating factor that I know that was used in the North High Band program.
Sure. Yeah, we will continue to consider that as an option.
So then my final comments relate back to the flexibility of staff, teachers, to to be able to implement an optional mask rule, but also to find a way to encourage masking in their rooms. Because as Ms. Romlow kind of stated earlier this evening, that a 7-year-old doesn't understand the impacts of masking or not masking. We hope that they might now by at this point of doing all of this stuff, but again, the challenge is that we can't put that on them to understand the choice of that. And I want our environments to be the safest, most productive environments possible. The direction that I think consistently that this board gave Dr. Davis was that we wanted kids to be in school 5 days a week.
We do.
That also suggests that we want our teachers in school 5 days a week as well, and we want them to have the most comfortable work experience for themselves as well as in the environment for children. So I guess I'm suggesting that if there's a way that we can communicate through the leadership of the principals, that if teachers want to encourage ways to offer masking elements or to extend some level of social distancing or higher mitigation standards in their classrooms, that they have the flexibility to be able to do that.
Okay.
So, and I think that'll go a long ways, other than saying everyone needs to fit within this shell that we, and Ms. Salomon gave us a great presentation of how things have changed from that. And if we're talking about masks being a choice, we should also be able to provide teachers a choice in how they manage their classrooms in regards to COVID as well. So that's all I have to say. You guys can respond if you want. But,
Yeah. I think we need to leave it to Dr. Davis and Mr. Kemmerer to operationally determine what's important for our principals and our teachers and thus our classrooms.
Yeah.
I don't disagree with you at all, but I think it's also, it's one of these things where our community also looks to us to also be a voice of advisement. And in no way am I telling Dr. Davis that he needs to do this. I'm providing advice of what I think might enrich our educational experience for next year.
And Ms. Wyman, you actually touched on the point I'm about to make, is that there's a misperception in the community that we are driving these decisions, and we're not. And I love that you just said we need to let Matt and Dr. Davis take over from here, because we are not analyzing the numbers, and we rely on them for their advice. I am not a healthcare professional, so I don't, the role of the school board is to support the superintendent and give him guidance and direction, which we have done, saying that we want schools open. And so just putting that out there, that we are not inputting these decisions. Thank you.
Yeah, I was just going to bring it back to the handbook and again say thank you for updating that. And going to your point, Mr. Peschel, there's been 16 pages removed. And as a teacher, I feel like that would give me more of what you're saying,
Sure.
more flexibility, more freedom in the classroom to do what I felt was best in my individual situation. So I just want to again say thank you for updating this handbook. I'm sure that wasn't an easy task. And I thank you too for keeping it, for not just throwing out what we did last year, but from building on that. So thank you.
Thank you.
Nice to have you back, Matt.
Any other comments from Dr. Davis or Mr. Cameron?
No.
No? Well, thank you
Thank
both.
you.
Thank you.
Mr. Cameron, I think you're up deck.
Yeah,
You're on deck
stay up here.
still, so next up, we have a workshop on the alternative education plan update.
All right, and Ms. Conrad is going to join me up here for this presentation.
Welcome.
So each and every year, our school district is required by state statute to review the options that we have for students who have been identified at risk, as well as the criteria that we use to identify students as at risk. So all of that falls within our PK through 12 supported and alternative education plan. So that can be found on our district website, and there's also links to it in the board report. For the sake of our presentation today, I'm briefly going to touch on a few of the high points of our plan, just for those who aren't familiar with it. And then we're going to spend the majority of the time talking about some of the updates that we made for this year. So we typically review the plan each year with a group of principals, alternative education teachers, and other stakeholders, and make changes to it. This past year, due to the situation around COVID, we did meet as an executive team and talk a little bit about what are some of the things that we're going to be changing this year due to COVID last year. So along with that, we got input from key stakeholders in different ways. We didn't have a large committee meeting in preparing it this time around. With that being said, I am going to pull up the actual document here and just kind of walk through it. So you'll see that in terms of the different sections, the first section really goes into demographics and overall philosophy of our alternative education plan. And that's really to outline, the purpose of this is really to outline strategies and interventions and instructional services that are available to all of our students and our families. So this goes into a little bit more detail on that. It also lays out the goals and objectives that we have in creating this plan. So overall, the Oshkosh Area School District wants to ensure that our students are college, career, and community ready upon graduation. And the objectives that are laid out here are things that kind of guide how we operate. So our first objective is to increase graduation rates for students, especially those who are disproportionately represented. We also want to increase opportunities for school success for all students through interventions, career, and academic planning. We want to continue to provide early intervention supports for students who are exhibiting risk factors. And then finally, we want to involve parents and guardians and students in the academic, social, emotional, and behavioral improvement process. Section 4 really goes into the applicable laws and statutes around this plan. And then Section 5 begins to define how we identify students as at risk. So that really lays it out for each grade level. The district has some flexibility in making that determination, but really there are some requirements that are defined by state statutes that are all included here. So we follow the state statutes pretty closely and don't have much in terms of additional criteria outside of that. So if you're interested, you can go back and take a look and see how we actually go about defining students who are at risk. Section 6 goes into parent notification, so we are required by law to notify parents anytime a student meets that criteria, which we do. And then moving into Section 7, this is really where we have most of the changes that occur on a regular basis. This is where our OASD program of services matrix is located, and I'm going to go into that here shortly. But that matrix really lays out everything that we have in place in terms of collaboration, services, and programs throughout the district. In addition to that, Section 7 has kind of a list of some of the key documents that we use as a district. And you'll notice that our continuums of support are in here for literacy, mathematics, and behavior. And our continuums of support are really our multi-level systems of support, if you've ever heard that term, but it really lays out the different levels of support and intervention that are in place for students, as we identify areas of need. So there are universal supports, there are supports in place for those that need a little bit of extra help, and then we have more intensive supports in place, and that's what those continuums really lay out. I believe it was back in June, we had a board workshop on social emotional learning, and we did go over the updated behavioral continuum at that time. So it's really a nice document. All our continuums are. So if you're interested, you can go in and click on the links here to see those. Section 8 identifies the progress monitoring options that are available to us as a district to continue to evaluate the progress of students at each grade level. So as you'll see here, there are a number of ways that we go about doing that. And one of the key changes I wanted to touch on too is at the high school level, we do have a new one this year, IXL. Julie, you want to talk a little bit about that?
So throughout this year, we noticed that students needed in particular supports, and particularly in math, to fill unfinished learning or to backfill gaps. And so IXL is a intervention piece, a supplemental piece that we're going to pilot to see how that can be supportive at the high school level. Because if you remember with iReady and iReady instruction, that's really designed up to 8th grade. And so high school has a different need. So we're piloting IXL as a supplemental support for math at the high school level.
Thank you. Section 9 goes into program evaluation, so how we continue to evaluate the plan that's been established. And then the last section just aligns this plan to our district policies that are in place in our manual. So that's it in a nutshell. I'm going to go back to section 7 here and pull up our matrix just so you can frame a reference to see what that looks like. So again, this matrix really lays out the community collaborations that we have, programs, services, and interventions. And there's a lot here. So it would probably take all night to go through each and everything that we have in place. A lot of great partnerships that we have with community organizations throughout the district. So a lot of these things will look familiar as we scroll down here in terms of supports that we offer both academically, behaviorally, and for student mental health. There's an additional section. These are more in-house OASD programs and services, but again, includes some of the key staff members that we have in place to support students and provide interventions like our behavioral ISTs, our academic ISTs, school psychologists, counselors, and then again, resources and programs that are in place to help students that need something different. This is the same link, so in the presentation, you want to try to turn it that way. And then in terms of COVID-19 changes for this year, that's really the basis for the changes that we did make to this plan. So Julie's going to talk a little bit more about those changes.
So we know that our different instructional models and the global pandemic impacted student learning, and specifically for students at the high school level. And so throughout the school year, we continue to monitor that impact, especially towards graduation and earning credits. So with that, we worked together as a team at the high school level, and we came up with different options for the classes of 21, so the graduating class that just graduated, to make sure that they had the opportunity to earn their credits and to graduate on time. We have options in place because we know this just didn't impact the class of 21. It's 22, 23, and 24. So in response to that, there were several things that were added or supplemented or expanded based on the needs of students at the high school level. So the first thing is at the second semester of this school year, or this past school year, we put into place Riverside Express. And so that was an additional section of our very successful alt-ed program that gets students rapidly to graduation for the class of 2021. And so that was during semester 2, and it was in response to the very high failure rate we had first semester. And you guys saw the data as far as where we were with failure rates, so we needed to respond to that. But going forward, to address the classes of 22, 23, and 24, we are adding an additional section at Riverside for 14 students. So that means 56 students can be served at any one time in those sections at Riverside. So we're going to go ahead and do that as for the foreseeable future, as we have needs, especially the class of 22 and 23. And then in addition to that, we put into place enhanced credit recovery options were implemented. And so our educators really thought outside of the box, leaned on standards-based learning, leaned on competencies, leaned on how can students in other ways demonstrate what they know and are able to do in order to earn those credits. We want our diplomas, we want our graduation requirements to mean something, so we need students to demonstrate that, right? But how can we do it in other ways that we can be flexible with them and they can stay on track to graduation? A key part of that was making sure that we had as many supports and options available in summer school. When the data is finalized, you will see we had many students take advantage of the summer school opportunity to recover credits that lead to a diploma and graduation requirements. We've also done things such as stacking. So in other words, a student may have failed first semester of a course, but during second semester, if they can demonstrate the standards in that first semester that they've accomplished them and they can show proficiency, we would go back and retroactively award that credit. So we've been really thinking, how can we get students to do that? Our second semester failure rates at both high schools were cut in half compared to first semester. So a lot of those things we didn't have to put into place, but it was really focusing on making sure we recover the credits from first semester.
That's it. Short part.
Great job.
Yeah, great job.
Any questions?
Just to thank you for all that you
Yeah.
guys are doing to help our students recoup those credits. And I know it's taken a lot of work and a lot of time, and so appreciative of all of that. Thank you.
I mean, that's really a testament to our educators because they know they've been very creative and innovative on how they do this, but once again, still maintaining those high expectations for that Oshkosh Area School District diploma because we know that has meaning behind it.
Mm-hmm.
So I personally got to observe several students at North that really struggled the first semester of the year. And having the opportunity to be able to stack some of those courses like math and such like that turned out to be a great benefit for them in the second semester. And so as a person who's not very good at math and trying to help students in doing that, it was like a great relief in helping some of those kids, knowing that they had that opportunity to be able to do that, and knowing that they were also able to be in school 5 days a week to support that adventure as well. I thought was really great. So it's good to hear those innovative ways of helping students catch up.
Yeah.
One of our primary focuses is student learning, student success, and to me this represents our guiding principle of students first. We're looking to make sure that every student is successful. We need every student to be successful, and it fits in with our strategic plan, making sure that every student is college, career, and community ready. And some of them will get there, but they need a slightly different path perhaps than, or maybe a majorly different path than some of their colleagues. So I really like to see these programs enhanced, and I'm very happy to see that the Riverside program has been expanded. It seems like every year we attract more students into that program, and there's often been a waiting list, and that can be detrimental to a student's future if they can't get into that program and be successful and take the next step. So I'm very happy to see that. So thank you for all your work and with the rest of the staff who are responsible for these programs.
See, no other questions. Thank you for your report tonight.
Thank you.
Thank you, guys.
Yes, thank you.
All right, next up, we have a workshop on health insurance. It'll be led by Mr. Nehans and his guests. Thank you. Good evening, everyone.
With me tonight are Laura Tank and Matt Johnson. They are with the Hayes Companies, and they are the benefits broker for the district. So they work with me and my office to kind of manage and do strategic planning within the benefits packages of the district for the employees. So we have presented to the board back in spring on potentially looking at a self-insured health plan rather than the fully insured. And at the time, the board recommended that we do projections of a renewal for both the fully insured and the self-insured model and try to cost that out and do that and present that again. And that's why we're here tonight. And we took a little bit different approach as we did this. We looked at this as a 5-year strategic plan within the benefits package and not just based on a 1-year renewal to really go on where are we going within the health benefit itself. So with that, I will turn it over to Matt and Laura.
Great, thanks, Drew. Like you had mentioned, we wanted to talk strategically with the district to really understand long-term goals and objectives. And so we put some of the goals and objectives up here on the PowerPoint. Certainly achieving something that's sustainable for the district, not just for a 1-year period, but a long-term period is something that's real, as well as enhancing the value of what's offered, not just for the plans themselves, but for the employees of the district too, to enhance that value so they feel a little bit more ownership of that program. Really to provide, again, I'm kind of stating what's up there, but a positive experience for them to really appreciate their health and really understand their health and encourage consumerism, meaning let's understand where we're going, how much it costs, what's the quality, and really try to drive longer-term behavior change, which would be a positive for both them as well as obviously to the underlying health insurance program. So we've run many different financial models over the last several months, and we're here kind of talking through a change to the model, the funding model towards a self-funded arrangement. We have kind of worked with Drew and his team looking at different options. We've selected the least best in class right now, a firm called Prairie Estates. We have a network that's called HPS, or Health Payment Systems. And we'll talk a little bit more in detail in the next couple of slides. We also have talked about offering potentially 2 medical choices. So a different choice, a dual choice environment for employees. Figure out what's right for them and their families, and a couple different price points to do that, which then also encompasses eliminating the health reimbursement arrangement that you have today, more so for an ease of simplicity of understanding the insurance, but also because of the plan designs we're reviewing, the deductibles are lower, the copays are lower, there isn't a need for that health reimbursement arrangement. So high level, maybe you've seen this in previous meetings, but high level, a little bit of difference between fully insured and self-funded. Fully insured, as you have today, as you think about, you pay a premium to an insurance company. That insurance company basically insures the risk, right? They set a certain dollar amount according to the risk of any population. It's a known cost to you. Every month you pay based on the number of people that you have. It's a known premium every month. It's obviously a little bit easier to budget for because you have a certain number of employees on the plan that are singles or families, and you know what the premiums are, and you just do some math. But the risk is also on the insurance company, and or I should say the reward when things are a little bit positive, meaning claims are lower than the premiums you pay. They keep the difference, right? They keep that money. So there is a little bit of flexibility with plan design, but not as much as you would have in a self-funded arrangement. Really to try to steer towards high-quality, lower-cost providers, try to steer more consumerism is something that exists in a self-funded plan. On the right-hand side, with the self-funded plan, there isn't an insurance company. So really, the employer, or in this case, the district, bears that risk. They bear the responsibility to pay fixed expenses, meaning finding someone to process claims, a network, a pharmacy benefit manager. All the little nuances of the insurance program are something that we would help place, but also fund those administrative fees. And then you would also have to fund the claims for medical and prescription drugs on a weekly basis. So there's variability to that, right? There's some cash flow variability to that. Not every claim is the same every month. It could go up and down. You would put some protection on the very high cost or catastrophic claims. Insurance called stop loss, so that's a one piece of insurance you would purchase. It would protect against any one individual breaching a very high dollar amount, where then you would have insurance to pay those costs behind the scenes. So there's a little bit of premium to share in that risk on that side. But otherwise, every other claim, kind of we say, quote unquote, more normal claims for a family in any given year are something that the district would bear. So again, you'd have to select the provider network, the network of hospitals and doctors, the administrator, the actual people who process the claims, as well as the pharmacy benefit manager, a person to manage the pharmacy side. And then you have the ability to determine what your plan designs are, what the underlying deductibles are, co-pays, what's in network, what's out of network, becomes a very much a real possibility to be very custom when you are self-funded. And over the long term, it should result in some cost savings when you're self-funded. When you're under a fully insured arrangement, they have certain target loss ratios that they want to achieve because they have internal costs. They have a little bit of profit margin. So there's a little bit of internal cost that doesn't exist when you're self-funded. You're basically attributed to yourself. And we want to measure that year over year, how your claims are fluctuating, more so than keeping any profit. You're not here to profit off your employees. And like I said before, you have the ability to customize and come up with innovative concepts to really drive people towards high quality, low cost, very similar to the clinic that you have. That certainly would be a big part of this, but also inside the community, there's ways to structure certain arrangements to steer towards high quality, lower cost places for people as well.
Matt, if I could add too, that's the mechanics of the plan, how the funding works, but from an employee experience, it feels the same. So there's still customer service. The plan design is actually a little bit more flexible. So, and from an employee perspective, they don't know if it's self-funded or fully insured.
Mm-hmm.
So this is a bit, again, the mechanics, the funding,
Sure.
financials.
Sure, absolutely, thank you. So in the current environment, you have Anthem for the employees. There is some concerns with the long-term affordability. Like I said, with fully insured arrangements, you're a little bit beholden to the underwriters and beholden a little bit to the market on what they're willing to offer as well as pay. There have been some concerns with service for employees over the years, as well as you have a custom network that's a little bit more limited, it's a little bit more narrow, so it does exclude a couple major providers here in the area. And we have mentioned that more so in plan design, there's a little bit of complexity with the health reimbursement arrangement. So there's a little bit behind the scenes, you have a higher deductible, but then you have this bucket of money on the side that helps you pay for that. So there's a couple moving parts that we could eliminate under a self-funded arrangement that would make it a little bit easier for, I would say, employees to understand, as well as to utilize their health insurance. So like I said, there are thorough reviews. We have reviewed the marketplace. It is recommended at this point for states as a self-funded plan administrator. It offers a flexible carrier, kind of a TPA carrier platform. It's, again, highly focused on customer service. To the employees, they'll get an ID card. That's what they need to show to the pharmacy, to the hospital, to their physician's office. But it comes with customer service behind the scenes that is a little bit above and beyond the kind of the typical experience. There's also ability to partner with a very custom consumerism model with Aletheus to really help people understand the cost in the marketplace, to understand if they're having a knee surgery, where should they go, how much does it cost before they have it done, so then they can make an informed decision. So there's a lot of techniques that can be put in place before someone incurs claims to help steer towards those type of places. It also would be recommended to move back to a little bit more broad network, meaning the major hospital systems in the area would all be covered, versus a little bit more limited that you have today. And then kind of on the side, there are some performance guarantees certainly in place with the recommended proposals as well.
So as Matt just mentioned, with the network analysis, there's a broad network available. So today would be considered a narrow network where not all major health systems are considered part of available providers. So Ascension and Freighter were two providers that actually there is healthy experience today where members are accessing these providers but paying a higher out-of-pocket benefit. And then also there's less discount, if you will, on those claims back to the plan. So with the model that we're looking at, it does include the health systems that are in the network today, and then also Ascension and Freighter. So looking at plan design options, you'll see on the left, this is the current single option available today. This is still fluid, there's still conversations, but the idea, if you will, the recommendations of what we're looking for, we're trying to achieve more value, real value and also perceived value. It's so important. Not today we cover preventative care with no copay, but we also need to ensure ongoing care. So eliminating any barriers to physicians. You know, today there's a deductible, the HRA, and then a copay. We would just eliminate that entirely and have copays for physician visits. More incentive for primary care services, no change to the pharmacy, but it would be a primary care center plan design. Overall is what we're trying to achieve here. So simplification, and then also dual choice, meaning meeting people with where they're at today. So both on a plan design and then also the premium.
Yeah, and the second one really puts in co-pays for a lot of different services, so it's a known cost when someone goes in to access care. They'll have an understanding of that cost before they actually incur those claims, which is also a very good thing from a consumerism perspective. So in terms of recommendations, like Laura said, a little bit of plan design is a little bit fluid, but we would recommend looking at self-funding for January 1st, which means terminating the insurance contract with Anthem as of the end of the calendar year. Any claims that were incurred in this calendar year would still be that responsibility for Anthem, so it's not something you would have to pick up. But, you know, starting self-funding as of January 1st, you know, using, like we said, Prairie States and HPS as the options for the TPA, basically the claims processor, as well as the medical network. We still need to secure that stop loss. It's a little early to secure stop loss insurance for the year, but we need to secure that. We built in some very conservative assumptions into our financial models to address that. But then certainly trying to introduce new plan design, like Laura had mentioned, to talk about simplification, to talk about value for both the district and for their employees. Really drive back to consumerism, drive back to understanding your health, understanding your options in the market. That will really go a long ways in the long-term view of managing the healthcare plan.
And I'd just like to add, as we conclude, one of the things I've really liked about the HPS network is it provides us the flexibility in the self-insured model to really be able to do some pretty creative things within our benefit plan. And there's a growing number of districts in our area in the Fox Valley that are self-insured or are moving to self-insured that are accessing this network. So one of the things that HPS network provides us and will continue to expand as more and more districts start joining their network is the ability to direct contract with providers. And that can be the Auroras of the world. It can be your small independently owned chiropractor, where we can reach out to the HPS network and say, we'd like to do direct contracting with chiropractors. We want you to go investigate who's the best in class, the best costs, the best outcomes, and then see what the best direct contract we can drive with them to bring our expenses down and still provide a really high quality experience for our employees. And they go out and do the legwork and then say, yep, we've added that contract. Now everyone within the HPS network is allowed to go utilize those contracts. And the way we're envisioning the 5-year plan is that anyone within the direct contract would just be a completely free service. No deductibles, no copays, no anything to drive people into our network of high cost or high outcome, very low cost providers. So this allows us that flexibility where a fully insured world, we're really at the mercy of that provider to do that for us. So were there any questions? I know we provided a lot of material prior.
I have a question. Our health insurance is one of the primary benefits that we give to our employees. Have you looked at a typical employee and their family, and based on what you were paying to Anthem to what the costs would be for same services with this new self-funding model, how it impacts their cash outlay?
That's a great question. So the plan designs we're coming up with, or at least designing at present moment, are something equivalent, if not a little bit better. But there is always a kind of a give and take in terms of when you go to access care, how much you pay, and then how much you pay out of your paycheck. So we're trying to balance both of those to be somewhat equivalent. So it might be a little bit more of your paycheck, but less when you go to see the doctor. And then there will be potentially another option that might be equivalent to what you're paying or a little bit less. You know, you may have to pay a little bit more when you go in and access care. So overall, we're trying to manage to that same outlay.
I just think that's really important question that we need to be able to answer for our staff. And, you know, it's easy to say, well, some's high, some's low, some's high, some's low. That's not really an acceptable answer to me if I had to talk to staff and say, this is what we're giving you. You know, it's a little bit too vague.
Yeah, and oftentimes in, say, an open enrollment meeting or an education session, we'd want to provide certainly examples of that. Here's a sample, you know, a sample family. Here's some levels of care that they access. Here's what they would have paid under last year's scenario. Here's what they would pay under these two new scenarios, so they can make an informed choice.
That's great, and if we could have that information prior to making a final decision, I think that would help the board be able to feel good about the decision.
Sure, absolutely.
The self-funded model really excites me because lots of organizations have went to this model and they've saved significant amounts of money. We're talking an organization our size, we could save millions of dollars annually by cutting out the more or less the middle person. So that really excites me. It really excites me that we have the potential to create a better network and provide a better service. But to piggyback off what Beth said, you know, the one thing is that's very important to all of us is to make sure that we are still providing just as good of a service to our employees at you know, a very affordable cost to stay in line with what they're used to. So if we can do all those things, then to me, this whole concept is a no-brainer.
I'll go next. So I'm very familiar with this whole thing. Mr. Nehans, we've talked. One of the direct contract offerings that was listed in one of the items was through Novo, who I worked with and helped start up. So very familiar with kind of what this looks like when it comes to incentivizing. Knowing that one of the areas that struggles as a struggle for a lot of people is when it comes to pre-certs and some of that stuff and the networks. And having gone through that, the flexibility is much greater with this. I'm not going to sit here and say that everything's perfect when you switch from one thing to the next, and there are, you know, obstacles. And I like what Ms. Wyman said about looking at the numbers, but I think it offers more of that flexibility. You guys can determine what needs pre-certs, where you're going, what you can do, and it really gives more options in that regard. The incentives, I mean, you mentioned one of the things that I guess for anybody listening or watching, you talk about incentives to go to direct contracting. Where I worked previously, they would contract with places out of Eau Claire because it was $30-some thousand less to do total knee replacements here than there. So they would ship their people here, incentivize them, cover the deductible, cover their hospital stay, and give them a couple $1,000s as well. And the business is still saving a ton of money. And so I think there's a lot of options there to be looked at. So I am very thankful for the work that you're doing and getting creative with this and trying to give our employees the best options for care. So thank you.
Seeing no other questions, thank you for your presentation this evening.
Thank you.
Yes, thank you.
Thank you.
Thank you.
All right, next we move on to the consent resolution agenda. For the consent agenda, the board has been furnished with background materials on each item and has discussed it at a previous meeting. These will be acted on in one vote without discussion. If a board member wants to discuss any item, it needs to be pulled from the consent agenda to be voted on separately later in the meeting. So there is one, I would like to entertain a motion to pull 1B.
Excuse me, you don't need a motion to do that.
Oh, that's right, sorry. We're going to pull 1B. All right. So then I'm looking for a motion for the board to consider the approval of one personnel resolution, A, appointments, temporary appointments, resignations, and salaries, C, resignation of an administrator, and D, waiver of a 30-day notice.
So moved.
Second.
Moved by Carnes, seconded by Herzog. Please call the roll.
Peschel.
Aye.
Szilagyi.
Aye.
Wright.
Aye.
Wyman. Aye. Carlin.
Aye.
Herzog.
Aye.
Carnes.
Aye.
The ayes have it. Resolution carries.
All right, so, give me a second to get my bearings. So we're going to proceed with resolution number 2 in individually considered resolutions. I'm going to read it first. Be it resolved that the Oshkosh Area School District Board of Education approve the retirements as filed with the Secretary of Board of Education. Retirements are Joseph Hameister, Jeffrey Schinker, and Kathleen Spalding.
So move.
Second.
Moved by Herzog, seconded by Szilagyi. Open for discussion.
I think it's important to recognize our quality staff in various ways, and this provides us with another opportunity to do that. People who have dedicated years of their professional life to making sure that our students get the best education possible. So we have a chance to thank and wish all the best in retirement to Joseph Hameister, who has been with the district since 2016, Jeffrey Schinker, a social studies teacher at West High School, who's been with the district since 2011, and Kathleen Spalding, an ID teacher assistant who's been at Oaklawn School, among others, and is retiring after 24 years of service. And I think it's important that we thank them for their contributions to the learning and the success of our students and wish them the best in retirement.
Any other discussion? Please call the roll.
Szilagyi.
Aye.
Wright.
Aye.
Wyman. Aye. Carlin.
Aye.
Herzog.
Aye.
Carnes.
Aye.
Peschel.
Aye.
The ayes have it. Resolution carries.
Thank you. All right, resolution 1B. To be it resolved that the Oshkosh Area School District Board of Education approve the administrative appointments and salary schedules as filed with the Secretary of Board of Education. Appointments are Trina Anderson, Philip Marshall, Amy Hughes, and Jacob Kellermeyer. Looking for a motion.
So move.
Second.
Moved by Herzog, seconded by Carlin. Dr. Davis, would you like to lead us?
Yes, so if I could have those individuals come forward, just to the chairs here. I just want to welcome some very familiar faces and then one new face to the district. So Jacob Kellermeyer is the new assistant principal, upon approval, assistant principal at Webster Stanley Middle School. So congratulations and welcome. So we have Trina Anderson, who is moving into the principal on assignment position, which is a .3 for the E-Academy principal, and also doing some mentoring in the principalship. So congratulations to Trina. Philip Marshall is moving over to Shapiro STEM Academy, so we're excited to have his leadership at the elementary level and moving us in the right direction there. And Amy Hughes moving in the same building, but moving to an assistant principal position. Really excited for her to have that influence at the new position. So just really proud of our professionals here and looking forward to a really strong year moving forward.
Thank you all.
All right, thank you.
And congratulations.
All right. We are at request for a future.
We need roll call.
Oh, I'm
Yeah.
sorry. I'm
Oh.
getting ahead of myself.
Yeah, let's make sure we vote.
Let's do it. Let's
Let's
just
make
wanna
sure we
vote on this,
approve it.
right?
Yeah.
Exactly.
Please call the roll.
Wright?
Aye.
Wyman?
Yes, aye.
Carlin?
Aye.
Herzog?
Aye.
Kearns?
Aye.
Peschel?
Aye.
Szilagyi?
Aye.
Ayes have it, resolution carries.
It wouldn't be a board meeting if I didn't try to miss a.
Robert's rules, yeah.
All right, we are at request for future agenda items.
Have one.
Yes.
I know that Mrs. Neiman is out right now on maternity leave, but at some point in the future, I would like to make sure that our community is involved in the timeline of the new Merrill Middle School, understands what the timeline is. And I've had a lot of questions, and I think that's really important to get that information out there on the website. Maybe it's a dedicated Facebook page to the new Merrill Unity, whatever it is, but we owe that back to our community.
So you're looking for a greater schedule and kind of path of what's taking place to be communicated?
Exactly.
Okay. Thank you.
You're welcome.
I'm pretty sure Dr. Davis can put that in order.
Yeah, absolutely, yeah. So we'll put that back on.
Okay. Any other future items? Seeing none. Any announcements? All right, seeing none, I would entertain a motion to adjourn.
So moved.
Second.
Moved by Carnes, seconded by Wright. Please call the roll.
Wyman?
Aye.
Carlin?
Aye.
Herzog?
Aye.
Kearns?
Aye.
Peschel?
Aye.
Szilagyi?
Aye.
Wright?
Aye.
Meeting is adjourned.
Thank you. Barb, thanks for these.